Hello everyone, I am Dr. Sneh Verma from the Department of Orthodontics, School of Dental Sciences, BBD University. In this video lecture, we are going to discuss about the types of orthodontic tooth movement. Orthodontic tooth movement is a complex tooth movement and involves variety of movements in all the three planes of space. Because the ultimate goal of orthodontic treatment is to move the teeth into desirable, favorable, and corrected position. Each type of tooth movement is the result of the applied moment and force. The moment to force ratio of the applied force determines the type of tooth movement and center of rotation associated with each type of tooth movement. Before going to discuss about the types of tooth movement, we must be familiar with some terminologies associated with the tooth movement, that is center of resistance. It is a point on the tooth where a single force would produce translation. That is all points on the tooth moving in parallel straight line. So it is a point at which resistance to tooth movement is concentrated. The center of resistance for a single rooted tooth was estimated by many different authors, and they suggested that it is located at about 50% of the root length. This was suggested by Prophet and Nicolai. Smith and Burstone has suggested the center of resistance of a single rooted tooth is somewhere located between the 50% to 30% of the root length. Whereas Burstone again suggested at the 33% of the root length. Nanda suggested it is between the 25 to 33% of the root length. Whereas for a multi-rooted tooth, the center of resistance is probably between the roots 1 to 2 mm apical to the furcation area. So here is the diagram. Single rooted tooth center of resistance is on the long axis of the tooth between 1/3 and 1/2 of the root length apical to alveolar crest. For a multi-rooted root, the center of resistance is probably between the roots 1 to 2 mm apical to the furcation area. Center of resistance of entire maxillary dentition is supposed to be located between the roots of the premolars within the maxillary sinus. And if we consider whole of the maxilla, then center of resistance of entire maxilla will be in the area of the posterior superior aspect of the zygomatic-maxillary suture somewhere here. Center of resistance is a fixed point for a tooth at a particular situation. It varies only in two situations: when there is a periodontally compromised teeth, as in the center of resistance shifts apically in periodontally compromised teeth. And with the loss of alveolar bone height, it causes the center of resistance moving towards the apex, but its relative distance to the alveolar crest decreases at the same time. So this figure shows a center of resistance for a normal tooth. When there is a loss of periodontal attachment, the center of resistance shifts apically, and in case of alveolar bone height, relatively it seems to be moved towards the coronal area. Next is the center of rotation. It is a point about which a body appears to have rotated as determined from its initial and final positions. The more nearly translation the moment, the further apically the center of rotation. In pure translation, the center of rotation will be at infinity. In the figure, it is well appreciated. This is the initial position and this is the final position after the tooth movement, and the center of rotation is here. Moment is a next term. Moment of the force is the product of magnitude of force and the perpendicular distance from the center of resistance of the body to the line of action of the force. So that moment is equal to force into distance, and unit of moment is supposed to be Newton per mm or gram mm. Coming to the topic types of tooth movement. So in reference to all these terminologies, we have different type of tooth movements as bodily movement or translation, tipping, torquing, rotation, intrusion, extrusion, uprighting. Translation. Translation of the tooth takes place when the crown and the root of the tooth move in the same distance and in the same horizontal linear direction. And in this situation, the center of rotation is at the infinity. And for this type of tooth movement, the required M by F ratio is 10:1. Next type of tooth movement is tipping. Tipping is the simplest of all type of tooth movement. When a single force is applied to the crown, it results in the movement of the crown in one direction and the root will move in the opposite direction. And depending on the position of the center of rotation between the apex and the center of resistance, tipping is of two types. This force, in this case, the least amount of force is required because the periodontal surface involved is less as compared to translation. In the previous figure, in this picture, you can see the whole of the periodontal area is involved on both the sides. One side, this is a tension side and this is the compression side. Whereas in tipping, the less amount of the periodontal, the red area is area involved in tooth movement. Uncontrolled tipping. When force is applied, the crown moves in one direction and the root moves in the opposite direction. In this case, center of rotation lies near to the center of resistance, and this is referred as uncontrolled tipping. Moment of force required is 5:1. This type of tooth movement is sometimes advantageous in class 2, GIF2 and class 3 cases where we need there is excessively uprighted incisors and we need to flare them out. Control tipping. In control tipping, the center of rotation is at its apex and the tooth is tipped from the point. The crown moves in one direction, as you can say, as in the figure, it is moving in the lingual direction, and there is negligible or minimal amount of root movement in the opposite direction. For this type of tooth movement, moment to force ratio is generally 7:1. Next is root movement or torquing. It can be achieved by keeping the crown of the tooth stationary and applying a moment and force to move only the root. The center of rotation will lie at the incisor edge. Here we require the greatest amount of moment to force ratio, that is 12:1. You can see only the root is moving and the crown is stationary at its place. Coming to the rotation, pure rotation requires a couple, and couple is a pair of equal and opposite non-collinear forces acting on a body separated by a certain distance. So no net force acts at the center of resistance, so no linear movement would take place and hence only rotation will occur because of the moment created by the force. Rotations are labial or lingual movements to a tooth around its long axis. You can see in this figure, there are two forces are applied to this rotated premolar in opposite directions, and that are generating a couple and correction of the tooth rotation. Intrusion. Intrusion is the displacement of tooth along the axis in an apical direction and requires least amount of force and is most sensitive. And the center of rotation for the intrusion of teeth is located outside the tooth. Here, the concentration of the force is concentrated at the apical area of the root. For the extrusion type of tooth movement, it is a bodily displacement of the tooth along its long axis in the occlusal direction. Here also, center of rotation is outside the tooth and there is a whole of the periodontal fibers are stretched in a similar amount. This is a table depicting the required amount of optimum force for the different type of tooth movements. Here, tipping requires a minimal amount. 35 to 60 gram force. Translation: 70 to 100 gram of force is required. For root uprighting, 50 gram to 100 gram of force is required. For rotation, we need 35 to 60 grams, and for extrusion, again 35 to 60 grams. And intrusion, the least minimal amount of force is required because it is 10 to 20 grams only. So this was a brief discussion about the types of tooth movement in the orthodontics. Thank you.